Well, when it comes to healthcare costs, the latest figures show spending grew 7.5% in 2023, which amounts to just over $14,570 a person. That's according to the Centers for Medicare and Medicaid Services. And most of that spending is on hospital and doctor visits, followed by prescription drugs. So how do we try to trim the costs of rising healthcare as we start a new year? Dr. Natasha Bhuyan of One Medical is here to help us out. Okay, let's start with the free services,
Yes.
again, keyword free, that are included in most health plans.
Yeah, so most health plans do cover preventive services at no cost, even high deductible health plans. And so it's a good idea to take advantage of those. I tell people at the beginning of the year around now, schedule that free annual wellness visit. It's a great opportunity to connect with your primary care doctor. You can get things like vaccines covered. People can also get free blood tests, so cholesterol checks, blood sugar checks, get your blood pressure checked as well. Cancer screenings are also free, so getting that mammogram, the colonoscopy, anything else you might be due for. And ultimately, the annual wellness visit, it's a really great opportunity to talk about your health goals, and your PCP can take the time to provide health education, diet education, and all of that is free and covered with no copay, and so it's good to just get that scheduled.
Now, I've noticed with the annuals, sometimes it seems a little shorter, right?
Yeah.
Let's be real. Doctors, they've got X amount of patients they've got to get to.
Yeah.
So are these kind of free screenings like your cholesterol, your diabetes, is that stuff that you have to ask for?
You don't need to ask for it. Your PCP should talk to you about it. But, if your PCP doesn't bring it up, you definitely should ask yourself.
Right.
And I do notice that, that visit is really focused on prevention and keeping you healthy. Sometimes people like to bring up some of their chronic conditions.
Yeah.
It's hard to separate your chronic conditions from how you stay healthy. And so sometimes you talk about both in one visit. But, if you cover all of those things all in one visit, the visit might feel shorter. So be sure to ask your doctor if there's labs that you want.
Yeah.
Bring a checklist to
I was
those
going to say, it
visits.
helps to write it down.
Write it down,
Yeah.
come ready. I love when patients come and say, I've got questions for you. It really does help guide that visit.
Right, and makes it, just more time
More
worthy.
focused,
Yeah, exactly.
yeah.
Okay, so prescription meds, that can definitely add up, but you've got some great ways to really try to rein it in a little bit.
Exactly. There's some smart tips here. So we know that buying in bulk, it really does save money. That same tip applies to medications. If you get a 90-day prescription from your doctor, it often is cheaper than doing a 30-day prescription. The other thing I also tell people is compare prices. People don't think about this, but a lot of folks go to these traditional retail pharmacies.
Yeah.
If you look at mail order pharmacies or online pharmacies, oftentimes the prices are cheaper. And even at two different traditional pharmacies, the prices might be different. We think they're always the same, but they're not. So make sure that you compare prices. The other thing I advise people is go online and look at those coupons. There's lots of coupons, discount codes. GoodRx is a good one. RX Saver is a good one. It'll actually list out the different pharmacies and different prices that you can compare. And one tip a lot of people don't realize is sometimes getting medications without insurance is cheaper than using your insurance.
Okay, so give me an example.
Yeah, so for example, Amazon Pharmacy has an RX Pass program, and so people cannot use their insurance. It's $5 a month. It's just a flat rate. There's 50 different medications that are generic that are part of it. So if you've got a blood pressure med and a statin, you can just kind of get all of that for $5 a month without using insurance. Walmart also has a similar program, and their generic medications are $4 a month. And there's actually been studies that show people who just don't use insurance for generic medications end up saving money in the long run, especially if you've got a high deductible health plan. So it is good to just kind of map out what's your copay, what's your deductible, how much are you going to spend on money, and figure out, should I use my insurance or not?
I know, I need a price compare because, a
Exactly.
lot of us do go the traditional route and just take it at face value.
Exactly, and people just go, their doctor sends it to one pharmacy, they show up, they pay that price, and they don't really do the
take it.
research. Exactly.
Yeah. Okay, what are some other tips to save money?
Yeah, lots of other tips. So, in HSA and FSA, those are really great savings accounts to actually use things for over-the-counter medications and other ways to save money. One that people often don't think about, it's really just understanding your insurance. So your insurance will have formulary medications. They'll have who's in network, who's not in network. So sitting down, understanding your insurance makes a really big difference when you're planning for the year.
Right.
Another one is telehealth options.
I have not done that.
I love this.
I get a little scared.
Well, those telehealth options are safe. And I would say with the advent of COVID, what we're finding is, if you've got a minor injury, if you've got a rash, a UTI, a bug bite,
minor stuff.
Exactly, minor stuff. You don't need to go to urgent care. You don't need to go to the ER. Oftentimes, you can just do a telehealth visit. We can treat people virtually, and it saves you so much money. So,
And time.
it saves you money and time. And look, I've also found that telehealth providers, if they can't treat you, and if it's safer to go to an urgent care, they'll tell you that. So sometimes it's a better place to start to save that time and money. So those are a couple things that I tell people. But ultimately, it's also just understanding like what costs are where you go.
Sure.
So sometimes people end up doing imaging or procedures at a hospital, and they'll have a facility fee. And that same imaging, that same procedure, it would have been cheaper if they went outpatient to an ambulatory care center. And so even something like a colonoscopy or a mammogram, sometimes those things are cheaper if you do it outpatient. So anytime you get a service, a procedure, anything in healthcare, ask about that cost up front and try to see if you're able to negotiate that cost or if there are other cheaper options.
Excellent, excellent advice. Natasha, thank you so very much.
I know it gets complicated.
Yeah, no, it is. But again, it's doing your homework prior
Exactly.
to, when you have that emergency.
Exactly.
Yeah. All right.